Hoarding disorder represents one of the most misunderstood mental health conditions in contemporary society, affecting millions of individuals worldwide while remaining largely invisible to the public eye. This complex psychological condition goes far beyond simple messiness or poor organizational skills, encompassing a persistent difficulty in discarding possessions regardless of their actual value, leading to the accumulation of items that congest living spaces and substantially compromise their intended use. The disorder fundamentally alters how individuals perceive and interact with their physical environment, creating a cascading series of consequences that extend far beyond cluttered rooms. The psychological mechanisms underlying hoarding disorder are intricate and multifaceted, involving cognitive distortions, emotional regulation difficulties, and information processing challenges. Individuals with this condition often experience intense distress when considering discarding items, driven by beliefs about the potential usefulness of objects, sentimental attachments, or fears of making wrong decisions. These cognitive patterns create a reinforcing cycle where the act of keeping items provides temporary relief from anxiety, while the growing accumulation gradually increases stress levels and functional impairment. Research indicates that hoarding disorder typically manifests during adolescence or early adulthood, though symptoms may not become clinically significant until later in life. The progression is often gradual, with individuals initially maintaining some level of organization before experiencing a steady decline in their ability to manage possessions effectively. Environmental factors such as traumatic life events, significant losses, or major life transitions can trigger or exacerbate hoarding behaviors, suggesting that the disorder serves as a maladaptive coping mechanism for dealing with emotional distress and uncertainty. The impact of hoarding disorder extends far beyond the individual, affecting family members, neighbors, and entire communities. Loved ones often experience frustration, embarrassment, and helplessness as they witness the gradual deterioration of living conditions and the increasing isolation of the affected person. Children growing up in hoarding environments may face unique challenges, including social stigma, health risks, and developmental concerns related to living in cluttered, potentially unsafe conditions. The disorder can strain relationships, leading to social isolation and family conflicts that further compound the psychological burden. From a neurobiological perspective, hoarding disorder appears to involve abnormalities in brain regions responsible for decision-making, attention, and executive functioning. Neuroimaging studies have revealed differences in activity patterns within the anterior cingulate cortex and insula, areas associated with error detection and emotional processing. These findings suggest that individuals with hoarding disorder may have fundamental differences in how they process information about possessions and make decisions about discarding items, providing insight into why traditional organizational approaches often prove ineffective. Treatment approaches for hoarding disorder have evolved significantly over the past 2 decades, with cognitive behavioral therapy emerging as the gold standard intervention. Specialized treatment protocols focus on challenging distorted beliefs about possessions, developing decision-making skills, and gradually exposing individuals to the anxiety-provoking process of discarding items. Motivational interviewing techniques help address ambivalence about change, while harm reduction strategies prioritize safety and functionality over perfect organization. Some individuals may benefit from medication, particularly selective serotonin reuptake inhibitors, though research on pharmacological interventions remains limited. The societal response to hoarding disorder has been complicated by media portrayals that often sensationalize the condition, focusing on extreme cases while neglecting the underlying psychological suffering. Reality television shows have both increased awareness and perpetuated stigma, presenting hoarding as entertainment rather than a serious mental health condition requiring compassionate understanding and professional intervention. This media representation has contributed to public misconceptions and may discourage individuals from seeking help due to shame and fear of judgment. Prevention and early intervention strategies remain underdeveloped, partly due to the gradual onset and hidden nature of the disorder. Increasing awareness among healthcare providers, educators, and community members could facilitate earlier identification and intervention. Educational programs that promote healthy relationships with possessions and stress management skills may help prevent the development of hoarding behaviors, particularly among vulnerable populations. The economic burden of hoarding disorder is substantial, encompassing healthcare costs, emergency services, housing issues, and lost productivity. Severe cases may require extensive professional cleaning services, structural repairs, or even demolition of uninhabitable properties. The hidden nature of the disorder means that many costs remain uncounted, as individuals often avoid seeking help until crisis situations emerge. Moving forward, research continues to expand our understanding of hoarding disorder, exploring genetic factors, developmental pathways, and innovative treatment approaches. Technology-assisted interventions, including virtual reality, exposure therapy, and mobile applications for decision-making support, show promise for increasing treatment accessibility and effectiveness. The integration of occupational therapy principles and environmental modifications may enhance traditional psychological interventions. Ultimately, addressing hoarding disorder requires a comprehensive approach that recognizes both the individual suffering and broader social implications. By fostering understanding, reducing stigma, and developing effective interventions, society can better support those affected by this challenging condition. The journey toward recovery is often lengthy and complex, but with appropriate support and evidence-based treatment, individuals with hoarding disorder can achieve meaningful improvements in their quality of life and functional abilities, reclaiming their living spaces and relationships from the overwhelming burden of accumulated possessions.